Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to continue our series on the heart, and to be more specific, I'm going to be covering the vessels of the heart. I'm going to be covering the vessels of the heart and the conduction system of the heart. Before we get started, as always, guys, I'm going to ask you to please support me and support this channel. If you appreciate the content that I'm delivering every single day, please like this video, subscribe to my channel if you haven't done so already. And if you can post one of my videos on your social media platform or tell a friend, colleague, coworker, nursing instructor about my videos, that would be greatly appreciated. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. Thank you so much, everyone that's been leaving messages for me to get well. As you can see, I got my voice back. It's still a little squeaky, but let me tell you something. I am back. And I'm so excited to get back to this teaching. So guys, thank you so much for the kind words and encouragement. I was not able to respond to everybody, but I read all of your comments, and it was just so heartwarming just to know that so many of you guys care. So thank you for that. All right, guys, let's get started. Again, I'm going to start with the heart vessels. So let me explain something to you. If you watch, excuse me, guys. If you watch the other parts of my series, I was very clear when I told you the arteries bring oxygenated blood, vitamins, minerals, nutrients, all that good stuff that's being carried in the blood. It brings it to the tissues, right? Right. And what do the veins do? The veins bring deoxygenated blood back to the heart to pick up oxygen, right? Right. Great. Here's something you have to keep in mind. The heart itself is a big muscle. The heart itself has to be perfused. The heart itself needs the oxygen, vitamins, minerals, nutrients. So when we're talking about the heart, things are switched. And you're going to see what I mean in a second, okay? So take a look. Let's start with the right and left coronary arteries. The right and left coronary arteries, they branch off from the aorta. That's the large artery that receives blood from the left ventricle as it leaves the heart. So let's go over here, and I want to show you what I mean. Take a look here. Here goes the descending branch of the left coronary artery. Okay, this is it right here, this red that you see. And over here, this red that you see over here, this is the right coronary artery. And remember, guys, look at this. This arch of the aorta, that's what brings the oxygenated blood to the rest of the body, your eyeballs, your arms, your liver, your spleen, your kidney, your stomach, everywhere, right? But remember, the heart itself, it needs oxygen, it needs that supply. Okay, let's keep going. Branches of the two coronary arteries bring blood to all the heart tissue. After it has passed through the capillaries in the heart wall, blood flows through the coronary veins. Let's keep going, guys. Follow me. These veins join to form a large vein, the coronary veins, which empties into the right atrium. So, guys, let me find a good picture so it can make sense to you. Here's a great picture. Remember, this right atrium, that's where it takes the deoxygenated blood from the superior and inferior vena cava. Great, right? But remember, the heart itself is a muscle, and it needs oxygen. It needs the blood. It needs the blood that carries the oxygen. Okay, so look at what we just read, and I want you to have a visual so you can understand what's happening. Let's go back. Look at what it says. It says the branches of the coronary arteries bring blood to the heart tissues. We know that. We know that's what arteries do. Arteries bring oxygenated blood to the tissues. So the branches of the coronary arteries, coronary meaning heart, the heart's arteries actually brings that oxygenated blood to what? To the heart. After it's passed through the capillaries in the heart, so the heart's been perfused, right? Look at what happens. Blood flows through the coronary veins. Remember, now what are the veins doing? The veins are going out. Take a look. These veins join to form a large vein, the coronary sinus, which empties into the right atrium. And the reason it's emptying into the right atrium is because it has to do what? refer back to my past videos, guys. It got to go through the atrium, through the ventricle, through the pulmonary arteries, to go to the lungs to pick up oxygen. Remember, the oxygen has to hop on to the hemoglobin, which is in the RBC, which is in the blood, to go where it needs to go. Okay. So that's what's happening. So guys, I don't want you to make it harder than it is. Just like you know the circulation of blood for the entire body, just remember that the heart muscle itself needs circulation. It needs that oxygen that's being carried in the blood as well. So with that being said, guys, we know that the coronary arteries, this is what supplies the heart itself, the heart muscle itself, with oxygen, vitamins, nutrients, minerals, all the good stuff that the heart muscle itself needs to survive, all the good stuff that the heart muscle itself needs to be perfused, right? So coronary artery disease, by the way, this is the leading cause of death in the US, develops when the coronary arteries or their branches become thick or blocked, reducing blood flow. What can make them become thick or block, reducing blood flow? Fat, cholesterol. And it makes sense as this is the #1 cause of death here in the US, right? This is the fast food world. We like to eat the foods that are fried, lots of grease. Okay, so it's that fat, it's that grease that can make those arteries stiff, that can make those arteries become more narrow, that can decrease blood flow, because that blood flow, the movement of that blood is going to feed to perfuse the heart muscle itself. The affected cardiac muscle becomes ischemic or lacking in blood supply. The tissues deprived of adequate supply of oxygen and nutrients. And that's why it's so important that those coronary arteries stay nice and clear and there's no obstruction, because it's through the coronary arteries that the heart muscle itself gets all the good stuff that it needs to survive, okay? So when this does not happen, and blood flow is either obstructed or it's slowed down, now that heart muscle is not being perfused, the patient can have a myocardial infarction. That is what's known as a heart attack. Okay. Now, what I said at the beginning of the video, that's something else that I was talking about. So just disregard. When I said switch, just disregard that. I'll talk to you about that in a minute. Well, actually, not in this video, in another video, but disregard when I said switch. That's for another video. All right, let's talk about the conduction system. Don't shoot the messenger. You guys have to know, generally speaking, you guys have to know how it works. And it's very easy. It's very easy. So each heartbeat is initiated by the SA node. You absolutely need to know that the heartbeat starts with the SA node. You have to know that. And you have to know that the SA node is known as what? The pacemaker of the heart. Whenever you hear pacemaker of the heart, this is what they're talking about, the SA node. So it starts with the SA node, okay? So it starts with the SA nodes. The impulse spreads through the atria, producing atrial contraction. One group of atrial muscle fibers conducts the electrical impulse directly to the AV node. So we go from the SA node to the AV node. Let's keep going. From the AV node, the impulse spreads into specialized muscle fibers that form the AV bundle. This is what's also known as bundle of His. In a second, we'll look at the picture and it'll make more sense, but just follow me. We go from the SA node to the AV node to the bundle of His. Where do we go after that? The AV bundle divides into the right and left bundle branches, because guess what? It's got to go to the left, to the right and left ventricles. You have two ventricles. So it's going to divide. It's going to go into the right and left bundle branches, which extend into the right and left ventricles. Guys, if you haven't watched my other videos that I've made for the heart leading up to this can be kind of confusing. So please, I encourage you, even if you watch this video, go back and watch the other videos so everything can make sense and kind of come together for you. All right, so we started at the SA node, which is a pacemaker of the heart. Then we go to the AD node. Then we go to the AV bundle. And remember, this is where it has to separate because it has to go to the left and the right ventricle, right? Right. Fibers in the bundle. Fibers in the bundle branches divide into smaller branches ending in terminal fibers known as Purkinje fibers. My light wasn't on. This should be better. Purkinje fibers. And the impulse spreads through the ventricles. So let's take a picture. Let's take a look. Everything that I just went over, it's right here. So number one, the SA node, the pacemaker of the heart. This is what starts that beat, right? Right here in the atria. Then from here, we go to the AV node. That's number two. And then from the AV node, it spreads to the bundle of his, or your AV bundle. That's our number three. Then remember, it has to separate because it has to go through the left and right ventricle. By the way, this is my right ventricle. This is the left, right? So this is the right and left bundle branches, okay? From that, that's number four. And then from that, those tiny specialized ones are the Purkinje fibers. And that's your number five. You have to know the conduction. You have to know the order. SA node, AV bundle, right and left branches of the AV bundle, Purkinje fibers. Easy peasy lemon squeezy. Let's take a look. What does it say down here? And remember, guys, I tell you, whenever you're studying and you see they're giving you the same information over and over and over again, you better bet your bottom dollar that's going to be a test question. Take a look. They talked about this whole conduction system here that I went over with you, right? Then they gave us a photo of the same conduction system that we went over, right? Great. And then they're giving us the same thing again. Look, from the SA nodes, the cardiac muscle of the atria contract. And to the AV node, the AV bundle. Then the right and left bundle branches to the Purkinje fibers, ordinary muscle fibers of the ventricles. Remember, it has to split off, and ventricles contract. Make sure you know it. Don't say I didn't warn you. All right, let's talk about the cardiac cycle. The cardiac cycle includes contraction and relaxation. So, and it's very easy, guys. It's not as hard as it sounds. I promise you, it's very easy. So let's go. It says events occurring during one complete heartbeat makes up the cardiac cycle. So everything that happens during one heartbeat, everything happens very rapidly, that is the cardiac cycle. It consists of contraction in which blood is forced out the heart. When you think of contraction, think of squeezing. So it consists of contraction or squeezing in which blood is forced out of the heart, and then relaxation in which the heart fills with blood. So when the chamber is contracting, it's squeezing, it's pushing out blood. But when it's relaxed, it's taking all the blood in and it's filling with blood, okay? The period of contraction, that squeezing that we're talking about, that's what's known as systole. That S in systole stands for squeezing. I want you to think of squeezing when you see systole. The period of relaxation where that chamber is taking in all the blood, that's what's known as diastole, okay? Let's take a look at figure 11.6. This one right here, I'll go over this with you in a second. Let's keep talking about, do I want to do that? No, actually, let's go over this figure right here. Let me make this a little smaller so everything fits. Okay. Excuse me. We're going to start with number one. The atria, you see these two, these are the atria. Atrial systole. So the atrium's what? It's contracting, it's squeezing, it's pushing out all of the blood. So these two, your right and your left atria, contracts and it pushes blood through the open tricuspid and mitral valves into the ventricles. Again, guys, you have to go back and watch my other videos for this to make sense, okay? So what's happening? The first thing that happens, both of the atria squeeze, the right and the left, it contracts and it pushes all the blood that was in the atrium through the mitral or through the tricuspid valve. So for this side, the right atrium, it's going to go through the tricuspid valve. And for the left side, it's going to go through the mitral valve into the ventricles. Okay? That's what happens. During this whole time, the semilunar valves are closed. They're closed because why? The tricuspid and the bicuspid or mitral valve is open. They're allowing blood flow into the ventricles. So during this time, the semilunar valves are closed. There is no blood that is going, out to the aorta or out to the lungs. Right now, it's just the ventricles that are taking in the blood. So while both of these atriums are squeezing, while they're contracting, what do you think the ventricles are doing? What do you think they're doing? Diastole. They're relaxing. They're taking in the blood. So this is the first thing that happens. Let's move on to number two. We're right here. Beginning of ventricular systole. So remember, number one, both of the atriums contracted, the tricuspid and bicuspid or mitral valve opened up to allow the ventricles to get the blood, right? While the atrium was contracting, the ventricles were what? In diastole. Great. But now the ventricles have the blood. What happens now? This is beginning of ventricular systole. So now it's the ventricles' turn to contract, to squeeze, to push blood out from the ventricles and push blood forward. So look what happens. Beginning of ventricular contraction. The ventricles contract, increasing pressure within the ventricles. And it has to. That's how it's going to push the blood forward. The tricuspid, that's this valve right here, and a bicuspid or mitral valve, that's this valve right here, they're closed. And it makes sense, guys. They're going to be closed because the bicuspid and the tricuspid valve, by the way, I know you guys keep hearing me say bicuspid if you haven't watched the previous videos. The bicuspid and the mitral valve, they're the same thing. You have to know the names of both, okay? There's a reason that these valves are closed. They did their job already. They were open when the blood was going from the high pressure atria into the ventricles. Now that the blood's in the ventricles, they're going to be shut. They've done their job. Now it's the ventricles' turn to contract, to squeeze, right? And the pressure in the ventricle is high because it has to push the blood forward. Okay, look at what it says. The tricuspid and mitral valves close, causing the first heart sound. And the first heart sound, guys, that's your S1. You know how when you listen to the heart, you hear lub dub, lub dub, lub dub, lub dub. The lub, that's your S1. That is your first heart sound. Okay, let's keep going. Here, there's a period of rising pressure. The semilunar valves open when the pressure in the ventricle exceeds that in the arteries. Blood spurts into the aorta and the pulmonary arteries. Remember, guys, those semilunar valves, those are what keeps blood from backflowing, right? So now that the ventricles, the pressure in the ventricles increase, the ventricles are contracting and it's pushing blood forward let me take a look to show you. So here, for that left ventricle, you're going to have this valve open up so that blood can go, where's blood going? Guys, give me a second. I'm having a brain fart. Give me a second. Oh, deoxygenated blood. Okay. So right here on the left ventricle, oxygenated blood is going to be going through the aorta. So the semilunar valve is going to open up. So the blood here, this is a high pressure area, right? This ventricle is constricting, it's contracting. So the blood here can go through that valve and then go out to the aorta and feed the tissues. Because remember, the left side of the heart, that's the oxygenated side. It's picked up oxygen already. And let's talk about this side. This is the right side of the heart. So the right ventricle, when the pressure is high enough, what happens is this valve opens up and then it goes through the pulmonary valve and it goes to the lungs to pick up oxygen. Okay, look at what it says. Semilunar valves. And remember, guys, those are the valves that open up for the oxygenated blood to go to the aorta and for the deoxygenated blood to go to the pulmonary system, to go to the lungs to pick up oxygen. So they open when the pressure in the ventricles exceeds that in the arteries. Blood spurts into the aorta, that's the oxygenated blood, and pulmonary arteries, that's the deoxygenated blood. And the reason it's going to the pulmonary arteries is obviously to pick up oxygen. So we're at number 3. Let's move on now over to number 4. Beginning of ventricular diastole. So now the ventricles are relaxed again, because remember over here, they were contracting. The pressure was increased. They were pushing blood forward, right? To either go to the aorta or the lungs. But now in step 4, the ventricles are relaxed again. Beginning of ventricular diastole, relaxation. Pressure in the relaxing ventricles drop because it was high over here, but now it drops below that of the arteries. The semilunar valves snap close, causing the second heart sound. That's your dub, your S2. Lub dub, lub dub, lub dub. That dub is your S2. That closing of those semilunar valves, that's what's causing that S2 sound, your dub. Let's go to number 5. And the last thing that happens, period of falling pressure, the blood flows from the veins into the relaxed atria. And remember, it's coming from the veins to the relaxed atria. Is this blood oxygenated or deoxygenated? It's deoxygenated. It's deoxygenated. It has to go through the whole, through the atrium, through the tricuspid, through the ventricle. It has to go through the pulmonary to go pick up oxygen. So right now it's deoxygenated. Blood flows from the veins into the relaxed atria. The tricuspid and mitral valves, also known as what? Bicuspid valves, open when the pressure in the ventricle falls below that of the atria, and it starts all over again. You guys have to understand this, okay? Because you guys will get test questions, especially you guys who are, pre-nursing students. When you're in the nursing program, I'm telling you, you're gonna get some test questions. You've never seen this before in your life. You're like, I don't even know what's going on. But because you understood the heart, you'll still get the answer correct. So I encourage you to go over this, make sure you understand it. All right, moving on. By placing electrodes on the body surface on the opposite sides of the heart, we can amplify the electrical activity and record it either with an oscilloscope or with an electrocardiograph. The written record produced is what's known as the ECG. That ECG shows us what's happening with the heart, what that heart's doing. Abnormalities in the ECG indicates disorders of the heart or its rhythm. When you listen to the heart through a stethoscope, you can hear certain characteristic sounds usually described as lubbed up. The book says lubbed up. I call it lubbed up, but whatever, you get the point. These sounds are produced each time the valve, what? Closes. Let's go back. Look at this. Your S1, your lub. Look at what's happening. The tricuspid and mitral valves close. Your S2, your dub, look at what's happening. Your semilunar valves close. That's your lubbed up, lubbed up, lubbed up, okay? The second heart sound, which marks the beginning of the ventricular diastole, is caused by the closing of the semilunar valves. Diastole is longer than systole. So it takes longer for those ventricles to relax and take in the blood than to squeeze out, okay? Diastole is longer than systole. So when the heart's beating at a normal rate, there is a slight pause after the second sound. Why? It takes more sound, it takes a little bit more time to fill than to push out. Thus, one hears lub-dub, pause, lub-dub, pause. Abnormal heart sounds, known as heart murmurs, indicate the possibility of valve disorders. Guys, as soon as that pressure rises and the valve opens, that blood is supposed to shoot forward to where it's going, and it's not supposed to go backwards. And what keeps it from going backwards are those valves. Those valves are supposed to be shut very tightly. But if there's something wrong with the valve, maybe it's the nose, maybe it's not closed all the way, some of that blood may regurgitate, okay? Which should not happen. When the valve does not close properly, some blood may flow backwards. This can result in a hissing sound. We should not be hearing a hissing sound. Murmurs can also be detected when the valve becomes stenosed. That means hardened, right? Becomes narrowed. There we go, narrowed and rough. Because when it's stenosed, what does that mean? That means less blood is getting through. So actually, I didn't mean hard. I meant narrowed, because that's actually true. When it's narrowed, that's less blood that's being able to flow through that area. And that is it for, I think that's it. Hold on a second, guys. Let me double check. Yep, that's it. The next video, guys, I'm going to... Next video, I'm going to go over cardiac output, stroke volume, heart rate, and all that good stuff. But for this video, guys, for the conduction, the cardiac cycle, that is it for this video. Please let me know what you thought about this video. And guys, I'm telling you, you really have to understand this. And at first it may seem a little confusing. You might have to watch this video twice. That's okay. Just make sure you know it by the time your test comes. Let me know what you thought about this video. Let me know what you'd like to see me cover next or more extensively. Don't forget, every Sunday, 1 o'clock Eastern Standard Time, I have a video that's released where I cover questions. I teach you how to answer the questions. I teach you how to eliminate wrong answer choices. So make sure you guys watch out for that. Don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. Guys, thank you so much for watching my video, and you guys will catch me on the next video.